Hi, this is a presentation for an overview of Healthy Community Brookfield, presented by Ashley Hawkins, the Executive Director. The targeted audience is Healthy Community Brookfield's Board of Directors, and this is being presented on April 23rd, 2022. The goal of this presentation is to educate the Board of Directors of Healthy Community Brookfield's current status. This includes the environmental factors and the strengths, weaknesses, opportunities, and threat analysis. Another goal of this presentation is the implication of the status quo, new strategies and tactics, and to also gain the Board of Directors' support for the launch of a comprehensive strategic plan. An overview of Healthy Community Brookfield. Healthy Community Brookfield is a nonprofit charitable organization who is dedicated to promoting public health and wellness to the county of Brookfield. Our programs include women's health/primary care services, prenatal and newborn care, mobile health medical services, employee health and wellness services to area employees, case management services to the elderly recently discharged from the hospital, a violence prevention program, smoking cessation classes, diabetes education classes for newly diagnosed diabetes patients, teen after-school programs, school health, wellness, and fitness programs, well water testing and water problem mitigation assistance, and vaccine and immunization services. Environmental factors. There are quite a few environmental factors currently with Healthy Community Brookfield, but here are some of them. Currently, programs are based solely upon grant funding and county allocations. The funding cycle for diabetes education classes and well water for the diabetes education class and the well water testing and water mitigation assistance will end in 3 months. Once funding ends for these programs, the Chief Financial Officer is concerned that administrative costs will need to be reduced. Key stakeholders in the community question the overall mission of the organization. The organization is described by many as a ship without a navigation system, rudder, or sail. HCB's unemployment is described as unstable, and we also did not meet the Public Health Department's accreditation requirements. We did not have a quality improvement plan, and this leaves the funding for prenatal and newborn care, smoking cessation classes, and immunization services vulnerable. So this brings us to the portion of the SWOT, or the strengths, weaknesses, opportunities, and threats. So for our strengths, Healthy Community Brookfield is viewed by the community at large as doing a good job. The majority of our board members have been with the organization for 15 years. HCB is viewed as a good place to work, and HCB is a subcontractor for the Brookfield Community Health Department. Some of our weaknesses include funding that is fully based on grants and county allocations. Our employment is unstable. The Director of Nursing is also serving as the Director of Quality Assurance, and we do not have a comprehensive quality assurance plan. Some of our opportunities include Brookfield County schools are struggling with the funding to maintain robust programs. The county also has several robust community services and organizations. We currently have a new executive director, and our subcontract is ending with the Public Health Department. Some of our threats can be perceived as Healthy Community Brookfield after-school program, and violence prevention program are seen as duplications of other agencies. Another threat is the private primary health care physicians. Our diabetes program is seen as a duplication of the local hospital, and the state-sponsored public health infrastructure is minimal. So, this is the part where I explain what Healthy Community Brookfield has had the same mission and vision statement since it began. And as we're restructuring our organization, I think it's important that we also revise our mission and vision statements. Our current mission statement is, as a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. And I would like to revise this mission statement to say, to improve the residents of Brookfield County's quality of life by promoting health and expanding wellness practices through outreach, provision of services, and ongoing education. Our current vision statement is, as a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. And the new vision statement would read as, we envision a county that utilizes best health practices, leading to healthy people living, working, and thriving in Brookfield. Broad strategies. I have come up with 3 strategies that we can start to help us restructure HCB. The first one would be to hold community health events to inform the community and community stakeholders of HCB's programs and how they differ from other agencies. The next one would be to collaborate/partner with the local school system on the after-school programs to help reduce program duplication. And then the third one would be to explore other sources of funding, such as fundraising. The action plan for community health events. What? So, HCB would hold an annual health fair to promote health, inform the community and community stakeholders on HCB's programs and how HCB programs differ from other local agencies. Who? So it would be a committee comprising of the Director of Education, the Director of Public Relations, program managers, and community health outreach workers that would help put this event together. When? The fair will be held once a year at the beginning of the fall. What resources? HCB will utilize fundraising. We will reach out to local businesses, foundations, churches, community members, and community stakeholders. HCB can also charge other local agencies to be a part of the fair, and this can help raise funds as well. And an example of other local agencies that we could partner with would be, for example, Meals on Wheels. Communication. The Director of Public Relations will reach out to local businesses and agencies. The Director of Public Relations will also set up a social media site to spread the information. Community health workers will pass out flyers in the community to spread the information as well. The action plan for the local school system. What? HCB will partner with the local school system on the after-school programs to help reduce program duplication. HCB employees will go into schools and hold after-school programs proposed by the school system. Who? So who will be a part of this? Program managers and community health workers will work with the local school system, principals, and teachers. When? We would like to start the start of the new school year, which will be the 2022-2023 school year. Resources. Some funding will come from HCB and the after-school program that we already have. We will also ask the local school system for funding, since they are having trouble funding their after-school programs. Outsourcing the after-school programs could help them financially. And then communications. The Director of Education will work with the school system to inform teachers, parents, and students. The action plan for funding. HCB will start fundraising by asking local businesses, foundations, churches, community members, and community stakeholders for donations. A funding committee will be formed comprising of the Chief Financial Officer, the Chief Executive Director, the Director of Public Relations, Program Managers, and a member of the Board of Directors and clerical personnel. When? This will take place as soon as possible. The next business day, which will be April 25th, 2022. What resources? Monetary resources will not be needed for this. And communications. The Chief Executive Officer will be responsible for informing the Board of Directors on the progress of fundraising. Evaluation. All these strategies will be evaluated with a plan, do, check, act plan. The results of this plan will be given to the Board of Directors. The Board of Directors will then decide if the strategies can be kept in place or scrapped based on the results of this plan. So, what is needed from the Board of Directors? 1. A member is needed to serve on the funding committee. Board of Directors can also help research other ways to increase funding, such as sponsorships, crowdfunding campaigns, and pledges. Board of Directors can also hold community meetings to hear community members and community stakeholders' needs. I would like to thank you, the Board of Directors, for your time today. And I also would like to thank you for making me the new Executive Director. Thank you for trusting and believing in my vision, and I hope that we can work together to restructure Healthy Community Brookfield. Thank you.